Thank you very much, and good morning to all our listeners joining us on 88.7 FM and 91.1 FM. We are broadcasting from the Alias Facez building on Emsall Road, where we are bringing you media launch, to be exact, of the Dominican Cancer Society. We now go across to join Father Reginald Lafleur, who is already at the podium.
Let us pray. Father, we thank you for this event, which is the official launching ceremony, Walk for Cancer Care 2022, and your promise for it. We know that when we gather together, you always have a divine agenda. We love you for that, Father, and even when we have done what we have done and have been asked to do, the results are so much greater than we ever could have. Our prayer today, Father, is that your will be done through this event. Take what we have prepared, multiply our efforts as only as you can. Steer our intentions to align with your righteousness. Remind us of your faithful provision when our efforts have failed us. We ask and we pray that to bless all our efforts and all our energies. We make this prayer through Christ our Lord. Amen. And now I'd like to invite the President, Mrs. Yvonne Alexander, President of the Dominican Cancer Society, to give a welcome and a media brief.
Matthias? Please kick in this, so the only one you'll be writing is that, and I'm only using it now. So after I use it, I take it right. A pleasant good morning to everyone. Thank you very much, Mr. Chairman. I want to acknowledge the presence of Mrs. Mignan Road Shillingford, Coordinator of the Health Promotion Unit of the Ministry of Health, Wellness and New Health Investments. I want to acknowledge the presence of members of the Board of Directors of the Dominican Cancer Society who are here present. Also, Ms. Juliette Lewis, a former member of the board, and now the coordinator of MEFCAS, which is a Methodist Church-based cancer support group, cancer and other illnesses support group. We want to acknowledge the presence. We want to also acknowledge the presence of the various media houses. Thank you very much for accepting our invitation to be here. Also in our midst are members of at least the children of individuals who have been affected by cancer, and a member of our youth and normally makes scholarship donations to these children at the beginning of every school year. We want to say a special thank you to Kyrie FM Radio, who is partnering with us in marketing and in bringing this media launch live via Facebook and radio. Thank you so very, very, very much. We could not do this without you. And of course, the staff of the Dominican Cancer Society. Welcome to the media launch of Walk for Cancer Care 2022. You will be pleased to know that we are back to walking this year. You may recall that owing to the pandemic, we could not walk in 2020. We had a drive, and last year we cancelled because there were spikes in COVID-19 cases during the months of August and September, when we were at the peak of our planning for last year's. We were hoping it would have been a drier day. So we are really very pleased, and based on popular requests and in consultation with the Health Promotion Unit, to bring you a walk again this year. This year's walk is being held under the theme Closing the Care Gap. This is the same theme that was used for World Cancer Awareness Day earlier this year. This theme is being used because it speaks to the need for everyone who is affected by cancer to be able to receive equitable, timely treatment, irrespective of economic or other conditions. We do still have individuals who succumb to cancer-related illnesses here in Dominica simply because they can't afford to pay for treatment. We still do have that. We still do have situations where individuals are succumbing within months of being diagnosed because diagnostic tests take a very long time to be done and to receive results. We still do have situations in which individuals simply are not in locations where they can access care in a timely manner. We still do have these situations. Hence, our continued campaign and focus on the theme of closing the care gap so that we can get to a place where everyone will have access to timely and equitable care. The annual Walk for Cancer is actually the main public awareness and fundraising event of the Dominica Cancer Society. This is the event that we use to not just raise awareness, but also to raise funds for this much needed cause. This year's walk will be held on the 1st of October. It's a Saturday, 1st October 2022. Patrons would be used to the fact that we normally walk from 2 locations, commencement points, Massac or Point Michelle. This year we have added a 3rd commencement point. It is the Palm Grove area. So patrons also have the option of walking from Palm Grove. The culmination point for this year's walk is the Windsor Park Sports Stadium. This is the culmination point for this year's walk, the Windsor Park Sports Stadium. We promise patrons a host of interesting entertainment at the brief closing ceremony. At the commencement points, we have already received confirmation from the parliamentary representatives of these various areas of their willingness to come out and address patrons at the commencement of the ceremony. And of course, the Minister of Health will address at the closing ceremony. We want to solicit the support of each and every one of you gathered here and those listening to my voice, and spread the word around. The Dominica Cancer Society need your fullest support for the walk. I think patrons will also be pleased to know that in addition to the walks that are culminating at the stadium, there will be a similar walk in the north of the island, Portsmouth. This walk is being planned between the Dominica Cancer Society, Northern Cancer Support Group, and the MEFCAS hence the presence of Mrs. Juliet Lewis here. So similar to the walk taking place in Roseau, there will be a walk in Portsmouth on the same day. So our supporters, our friends in the north, you are not going to be left out. There will be a walk in the north. You do not have to travel all the way to Roseau. There will be a walk in the north. We're ready to look towards the support of each and every one of you to make this walk a success. We solicit your support through the purchase of the t-shirts. They are available already for sale at a donation or contribution of $30, which entitles one to water during the walk. So it covers the registration, the t-shirt, and water that you will receive during the walk. We thought the walk was a much better option, a healthier option than the drive. Actually, that decision was taken at a meeting of partners, and one of the issues that was raised was the issue of the rising cost in fuel and the fact that walking is healthier. The additional location is to minimize the possibility of very large crowds culminating at the two commencement points. So we have a third commencement point in Roseau, and those who are closer to the north would convene at the northern commencement point. Discussions are ongoing regarding the commencement and culmination points for the work that will simultaneously take place in Portsmouth, and that information will be communicated as soon as plans are finalized. So, my final words are to all our supporters, our patrons, our friends, our sponsors to come on board with us. Every man, woman, child who is able-bodied should get a t-shirt and walk with us. Yes, we do have children's sizes. By wearing the t-shirt, you are assisting us in raising awareness and spreading the word that early intervention saves lives. It's written on every t-shirt. By walking with us, you're assisting us also in our fundraising drive. Quite apart from the sale of the t-shirt, we do also have donation sheets. So members of the Dominican Cancer Society will come to you soliciting donations for this very worthy cause. All the monies that are collected from these ventures are utilized to assist individuals to meet the cost of cancer treatment. This is what we use the money for. So we're asking you to give generously. It does not matter how much you give, every little bit counts. Every little bit counts. So the donation sheets and supporting those who will approach you for donations is as important to us as you buying a t-shirt and walking with us. So please give generously. We also solicit your support in spreading, in you taking responsibility for your own health. We would much prefer that no one in Dominica was affected by cancer. We would much prefer that. Unfortunately, this is not the case, and so we are appealing to you, the general public, once again, to please take responsibility for your health. Your physical health, including what you eat and drink, and most importantly, screening. You will hear us speak about screening. You know, we just can't stop talking about it. Early intervention does save lives. There are numerous individuals who have survived a cancer diagnosis because it was early intervention and timely treatment. So we thank you for being here. We thank you for tuning in to Kyrie or the Kyrie Facebook Live. We thank you for your continued support for the Dominican Cancer Society, and we look forward to it much more now. Thank you so very much. Please work with us. Please support us. T-shirts are available at the office of the Dominican Cancer Society. We will have a live page on our Facebook page where you can actually just order your T-shirts and it will be set aside for you. Please do not run the risk of the walk is tomorrow and you do not have a T-shirt. Okay, so the walk is the first Saturday of October. Purchase your T-shirts early because T-shirts are available only while stock lasts. We want to really encourage you to support us, walk with us, help us raise awareness, take care of your own personal health and wellness. Thank you so very much. God bless you all.
Morning. Okay.
Thank you very much, Mrs. Alexander, for an elaborate welcome. The emphasis has been on walk-in. This is walk-in. And so we're still in the era of pandemic, and so now invite Mrs. Mignon Roll Shillingford, who is the coordinator of Health Promotion Unit, to share with us the protocol that will be involved in terms of walking, COVID protocols for walking.
Hello, good morning to everyone. Hello, good morning. Okay. Hello, good morning to everyone. And of course, it's always nice to be here, great to be here to partner with the Dominican Cancer Society in launching of our Walk for Cancer Care. Sadly, our PS of Health would have been here today, but she is unable to. So I just want to say a few things on behalf of the Ministry of Health, and then I will speak a bit about the protocols. Okay? Is that okay with everyone? It's a happy day, so I want to see you smiling with your eyes. Okay, so as I said, it's always great to partner with the Dominican Cancer Society in holding this cancer walk. And of course, we understand the significance and what cancer has been doing to us in Dominica. You know, it is very important that we consider and we look at the risk factors for cancers and for NCDs. And if I didn't say that, something would be wrong. What are our risk factors? Unhealthy diets, what we eat, what we put into our mouth, because we speak of prevention, right? What we eat, our diets. We have to look at physical inactivity. Okay, so a lot of us, especially those of us who work in offices, a lot of time is spent sitting down at a desk in front of the computer. And during this COVID pandemic, this activity extended to a lot more other persons, right? Where you spend a lot of time inside, indoors. Now is the time to get back on track, get out there, get moving. And that is why we even identify that the walk this year, seeing that we still have COVID, but it is reduced, that we need to walk, right? And we are hoping that can always also catapult the need for working amongst a number of persons. They will do the work and they will enjoy it so much that they may continue doing it with groups. Okay? So the other thing is tobacco smoke, tobacco and secondhand smoke. A lot of persons do not identify or do not know the number of cancer-causing agents, but not only cancer, all of the other NCDs, diabetes, high blood pressure, and respiratory condition are associated with tobacco smoke and secondhand smoke. So that means that it doesn't only affect the person who smokes the tobacco, it also affects the person who inhales the tobacco through secondhand smoke, and just as bad. Okay? And then, of course, the other one, which a lot of people do not like to talk about, alcohol consumption. And of course, we are seeing what is happening. We are not blind. You're hearing people talking about this weekend, my liver on fire, like a joke. Right? So alcohol consumption is just too much all over the place. And we have persons from a very, very young age starting to drink alcohol now. These are our main risk factors. One other thing I want to speak about in terms of NCDs is our mental health. For the past couple of years, it has been very rough. And we know stress can affect every single system of the body, including activating cancer cells that are in your body. So stress causes cancer. And it has been very hard coming from Hurricane Erica, Maria, and then this COVID pandemic. So we have to address our mind. It controls what we eat, what we do, what we think, and our stress levels. Okay, so I needed to say that. I also wanted to say that in terms of give you a little data as why this activity and in terms of diagnosis and screening and early intervention of cancer care is very important. In front of me, I have the data for Dominica in terms of cancer deaths from 2017 to 2021. And yes, it has been on the increase. Yes, we are seeing some cancers that we would not see showing up before. And while we talk of prevention, we also have to talk about screening and treatment, because we do not want our persons dying from cancer, especially cancers like cervical and breast, when early intervention and monitoring will prevent death. So in 2007, we had a total of 98 persons dying from cancers, 57 male and 41 female. In 2018, we had 82 total, 44 male, 38 female. In 2019, we had 117 deaths, 78 male, and 39 females. In 2020, we had 144, 91 males, 53 females. And in 2021, we had 143, 78 males, and 65 females. So we are seeing from 2017, we had 98, and in 2020 and 2021, we had 144 and 143, respectively. Now, the other thing that should have stood up for you is that our males. So in all of the years, more men are dying from cancer. Okay? So I just want to keep that in your mind. And of course, also to help you in your resources, allocation, and your programs in relation to cancer prevention and screening. Okay? So I felt that I just needed to share that. And I want everyone listening to me to come on board with the Dominica Cancer Society. We are seeing what is happening. You could be giving towards your cancer treatment, because we do not know which of us are ready or who of us already have cancer being multiplied in our systems. Okay? Dominica Cancer Society has been doing an excellent job in giving support, both emotional, social, psychological, and financial with cancer care patients. Okay? And giving could be an investment in yourself or your family. Thank you very much for that. So let's talk a little bit about our work for cancer care. And already you will notice that a few strategies, activities have been done by Cancer Society to kind of spread out the number of persons that are going to congregate. So for one, there are now free locations, and I like to repeat, so we'll have our usual from the MAMS area in Massa. We have from Point Michel, and the new location from Palm Grove. Okay? So, if you live in the Valley area or even as close as Buffett State, you may choose to go that area. Then we are also having, Cancer Society, the Northern Walk. So persons who would normally commute all the way from Portsmouth, Marigot, Wesley, Capuchin, can now do it in the north together with Medcast and the Cancer Society in Portsmouth. Okay? So you have, it will be done on the same day, so the vibes will be real, right? And we're going to walk. Now, as I mentioned before, while we had been seeing decreased cases of COVID-19, COVID-19 is still here. We are still seeing cases, and recently, maybe a 3-week period, we have been seeing increased numbers. Okay? Now we know persons who have chronic conditions, or they are immunocompromised, so persons who have cancers, persons who have diabetes, sicklers, all these types of people are at higher risk for complications from COVID. So we want you to walk safely, right? So one of the things we expect that if you are ill, if you have any flu-like symptoms, you will not participate in the walk. If you are going through treatment, any form of treatment that may reduce your ability to fight infection, we would not want you to participate in the walk. Okay? So those two things, you are not well, you have a flu-like symptoms, because we also know there is a flu going around. It's also flu season going around. Now, a flu for a person with a decreased immune system can also be very harmful, normal flu, okay? So if you have any symptoms, if you're coughing, you're sneezing, or any flu-like symptom, you should not participate, okay, in the walk. Then, as much as possible, if we would like you at starting points to pull up only with persons in your immediate grouping. So for instance, your family members, your co-workers that you have been congregating with before, this is. So try not to mix and mingle too much. Okay? So if you have your business or your work or your community group participating, click with them. Now, because of the difficulty in walking and breathing with the mask on with this walk, we cannot say use the mask to do the walk. Those of you who believe that it's possible for you, you have been doing it, because there are some persons who have been doing it. Yes, we want you to do it. Okay? But do not congregate, especially with persons outside of your area or you have been thinking with. Do it in your different groups you already interact with. Okay? Then, when we reach to the main venue, of course, we have to be cautious, and there will be sanitization stations, because we know hand hygiene is very significant. Because even when we speak, so for instance, we do not wear masks and we speak, our droplets drop on surfaces, we touch surfaces, then we touch our eyes, our nose, and our mouth. So we want to try to keep your hands as clean as possible. We want to ensure that the different bathrooms and any contact areas will be sanitized and clean. And at that venue, we would like you to use your mask as much as possible. Okay, so when we culminate, remember the mask mandate is still in force. It has not been removed. Okay, so for your own protection, right? Your own protection, when we culminate at the point, which is the stadium, that we want persons to use their mask and sanitize. Okay? These are not very difficult protocols. You are not well, stay home. Do not, as much as you want to, give the donation, but for protection of yourself and also other persons, remain home. If you are undergoing any treatment and make you more at risk, right, for any viruses or any infections, we would like you to stay home as well. Okay? Simple, very simple protocols. I also want to say that vaccines are still available. So the COVID-19 vaccines are still available, and we know they work in reducing the complications and severity of COVID-19. If you are a high-risk person, somebody who has a chronic condition, that vaccine is for you, for your protection, because we are still having cases. And from what we are seeing, this is going to be amongst us for a while. I don't even want to have the same using of masks and sanitization and trying not to be so physically together. Okay? So we want you to be mindful of that, and that is all. Apart from that, we want you to come out in large numbers. In 2019, I think we had a record-breaking number of participants. In 2020, although we didn't do a walk, we did a drive, and it was still record-breaking. You know, it was very good. We started in town, and we had stopped in Margot, St. Joseph, and we culminated in Portsmouth, and it was very good. And this year, now we outside, I want us to do it even bigger and better. Thank you very much.
The protocols will be observed to the best of our ability. Thanks for the insight that you gave us in terms of the simplicity of the protocols. Not complex, very simple. And we assure you that we will ensure that they are observed. As part of our Dominica Cancer Society activities, we have a dynamic youth arm under the leadership of Ms. Tamara Cornelius. And part of the activities is engagement of young people like themselves in promoting and offering scholarships. So Tamara is here this morning, and she's going to hand over to the deserving students the scholarships that are being awarded. Tamara.
Hello, good morning, everybody. I am Tamara Cornelius from the Dominica Cancer Society Youth Arm. We are a small group, which is a subsection underneath the Dominica Cancer Society. And we just do advocation and directly and indirectly try to impact the lives of students and children who are affected by cancer. Because as we say, it's not only the parents, but the child gets affected also. So today, we are going to give back. So throughout the year, we have had sponsors, we have done fundraisers, and the Society of Dominica has really supported us in raising funds, so today we could give back scholarships. Although we did not reach the anticipated amount that we thought that we would reach, because there are a lot more students out there that need the help, we are proud to say that we can give 7 scholarships today. So without further ado, I'm going to give the 7 scholarships. Our first recipient of today is Tristan Toussaint. Tristan Toussaint? Okay. Jahil James Buck? Kelton Pierre? Keldon Pierre? Joshua George? Brittany Augustine? Tyler John Baptist? Briley Samuel? Joshua Kai George? We would like to give a huge thanks Jiley James Book. On behalf of the fellow youth farmers, we would like to thank the Dominican Society, our sponsors, the Dominican Cancer Society, and our various persons who aided us in doing all our fundraisers. If I left out anybody, I would like to still say thank you if you helped it and assisted it anyway. Thank you very much.
In everything, we give thanks.
A small donation to the Dominica Youth Fund. Towards your scholarship program from Carl's Pepper Sauce. Small as it is, I hope it goes a long way.
It will. Thank you.
In all things, we give thanks. We give thanks in the first instance to the Almighty, who's made it possible for us to be here this morning and to launch officially our cancer walk for 2022. We want to say a special thanks to the media houses who are here, present, and who have made it possible to bring this gathering here live, so that I think it's also on Facebook, so that it is live. And so a special thanks to our media houses who are here. A special thanks also to Mrs. Mignon Roll Shillingford, Coordinator of Health Promotion Unit, for sharing with us the protocol to be observed for that special occasion and also other occasions. Special thanks to the youth arm for that gesture of theirs, very brilliant gesture, that they can reach out to young people like themselves, because the youth arm, they are young themselves, so they can reach out to young people like themselves and offer a gesture of scholarship. It's not very easy to educate a child, but then they have expressed by their actions that they are willing to help other young people like themselves. And so, to Taimira, special thanks to you and your youth arm. Give the others our regards and our appreciation. To all of us who are gathered here, especially the president of the Dominica Cancer Society, Ms. Yvonne Alexander, who made it possible for us to be here and have the official launching for our cancer work for 2022. Those of you who received the scholarships, special thanks to you. And those of us who are present here, sitting as guests, special thanks to you. Without you, the hall would have been empty. So a special thanks go to everyone who has made it possible that this morning's activity is alive. I did thank the media. Yeah, they were the first I did. And if I forgot anybody, thanks to you. Thank you again.
That's it. That's it from our end here at the Alias Forces building on Emsor Road, as we bring this broadcast to a close on the genuine sound of Dominica Kyrie FM. Thanks again for listening. Thanks for watching. Kyrie FM continues to throw its full support behind the Dominica Cancer Society as a partner in all of its events. You can join us on the first Wednesday of every month for live coverage of the Cancer Society program, Surviving Cancer. That's every first Wednesday in the month, and that's from 7 p.m. on Kyrie FM, the genuine sound of Dominica. This year, the Dominica Cancer Society has decentralized its work for cancer, and will be done simultaneously in Roseau and Portsmouth on that day. And we also heard the statistics as presented by Mignon Roll Shillingford, and we will hear more hopefully from Mignon Roll Shillingford a little later today at another live broadcast, but from the Dominica China Friendship Hospital from 2:30 thereabout this afternoon. We also heard from Yvonne Alexander, again appealing to the public to support, and one of the ways that we can all support is by purchasing our t-shirts from the Cancer Society for the Work for Life. I remember in 2019 it was really successful, very successful. That was the largest number we've ever had in years since the Work for Life has taken place. And this 2022, like everything, seems to be coming back to normal. We have no doubt that this one is going to be really exciting. So again, support the Dominica Cancer Society. Kyrie FM will be there to bring it live as well. On behalf of my technician, I am Steve Vidal, saying thanks again for watching, thanks again for listening, taking you back to Master Control. Join us again at 2:30 this afternoon from the Dominica China Friendship Hospital. Good morning.